Wow. Okay, the time has finally come to make a really big decision in my life. It's a decision that affects my health, my well-being, and my happiness. I know that many of you have probably noticed my teeth in previous videos, and I've been back and forth trying to figure out what to do. Yeah, I've looked into implants, but got to take out like a freaking car loan to pay for those. I thought about just trying to live with it because, you don't see it that much because my mouth is so small. But then I try to smile and my smile looks like, I can't do the closed mouth smile. I did a lot of research, talked to a lot of people, and I've decided that I'm going to get dentures on my top teeth. I don't know what it's going to be like. I don't know what the adjustment's going to feel like. I don't know what the pain is going to be like. And those are some really, really scary thoughts. My mother has full set. She's had them as long as I can remember. I think I was probably 4 years old when she's had them. And they were ugly. Sorry, Mom, but that set you had back when I was a kid was ugly. A lot of gum. The gum was really brown, and the teeth looked very, very fake. Like, you knew they looked like almost like wooden teeth. Like they used to wear the presidents and stuff back in the 1700s, 1800s, and I really didn't want that. But my mother has got a new set now. Got them fairly recently. She has a full set, top and bottom. I'm trying to save the bottoms. I think I might do one implant right there and then save the bottoms. I'm still up in the air because they said it's a lot easier to keep the bottoms and do the tops. I went to dinner with my mom, and I watched her eat. I watched her talk. I watched her teeth, trying to see if it would be. It's obvious to me because I know that she has them. I haven't been able to eat a lot of things. Hard crunchy. I loved Nature Valley granola bars. Can't eat those right now. Ice cream, because the way the teeth are falling apart, there's so much exposed nerve in there that anything cold affects the sensitivity of my teeth. I can't drink out of a glass without a straw. Just all these things that... Steak, oh my God, I cannot eat a steak. Those kind of things, I guess, are the factors that have really led me to this decision. It's genetic, to some point. Calcium deficiencies, poor hygiene as a child, all those things have led to my teeth just crumbling in little pieces. Like I would take a bite of something and there'd be a part of a tooth in it. Just a little piece of a tooth. Just little pieces, like little pebbles that would come out every time after time. Sorry for the shaking of the phone. I'm just trying to hold it without my selfie stick because I don't know what I did with that. Just weighed all my options, pros and cons, and I think that I will be a happier person. I think that I will laugh more and smile more if they're fixed. My daughter and my fiance have both been on me about, hey, you need to do something. You really do. It's probably not good for my health either. As my teeth deteriorate in my mouth, my gums will get to an issue, and then my face could change shape, affect my jawline. Who knows what could happen. So I made the appointment. I'm going on the 22nd of August. I'm terrified of the pain, of how it's going to feel, how it's going to look, how I'm going to feel after, how long I have to go without work. I've only taken the day of the surgery off and the day after. I figure if it's sore, it's sore. I have to work. that's going to be stitches, or it's going to be, I'm going to have to go back every couple of months for them to adjust, because my gums are going to change as they heal. The first couple of weeks, I think I can only eat soft foods. I was just thinking today at work that my favorite popcorn was going on sale, and then I sat there and I was like, oh, but I won't be able to eat popcorn for a while. I may not ever be able to eat popcorn again, because they'll get up in the top of between the denture and my mouth. I know they make these fixodents and polydents and all kinds of like sealants. I don't know how that works. I don't know how any of it works. I know I gotta use a different brushing mechanism, like Efferdent or something. I don't know. There's so many unknowns. I know I can go on YouTube and check and look, but then I'll get myself overwhelmed and the anxiety will come in. So I'm going to take the step. I'm going to take the leap. I'm scared. And I know that I'm not the only woman out there that's scared of any kind of medical procedure. Any kind of teeth are the worst. I never went to the dentist when I should have or could have. I used the excuse of, I don't have insurance, it's too expensive. Just all these things that you look back and say, I could have, would have, should have done differently. But it is also genetic. I told you my mom's got them. Several of my family members have them. It was just destined to happen. And I've waited. I think it started happening about 4 years ago. I'd started noticing things falling and chipping, and then I kept hoping they could, do a crown or something over it, or maybe do a partial. And it just, when I was in the 3rd grade, I knocked these 2 in the front out. These 2 tripped over a kickball or a dodgeball in gym class and busted them out. So from the time I was, 9, 10 years old till I was 21, I was in and out of the dentist all the time, getting them replaced and adjusted. And I'd hit them on something or try to bite into something, and they'd fall off because they were temporary until my mouth had fully grown. I won't even look at pictures of myself in high school because I looked like I had too many chiclets in my mouth. So I spent a lot of time at the dentist as a child. So when I became a young adult, I think I just said toothbrush and toothpaste to be enough. But I never brushed enough, I'm sure, and I didn't floss, and I didn't go to the dentist. But then again, I could have maybe saved it because of my genetics, if I would have done things a little more productively. So if I can give a piece of advice to anybody out there, just take care of your teeth. Because you only get 1 set. Well, 2 if you count your baby teeth, but they don't last long. Anyway, I'm trying to be upbeat. I'm trying to keep my mind on what it's going to feel like, what it's going to look like. I'm going to have a nice smile. I'm going to be able to smile in pictures now. The holidays are coming. I look back at my daughter's wedding, and my smile is just not what it should be. And I'm sorry for that, baby. I really am, and I should have done this before it. But fear. Honestly, fear has been my biggest thing. And I still have, fear, not just of the pain. Oh my God, the pain it'll be worth it, I'm sure. But just how it's going to look and how it's going to be and how I'm going to adjust and what I got to do and how, just all the things that are how it's going to affect me. So I'll keep you posted. August 22nd is coming up pretty quick. So if nothing, please pray and wish me luck, because I'm going to need it all.